Good morning, everyone. Thank you all for being here on a bright, not quite bright, morning here at lovely Edmonton Unlimited. We want to thank Edmonton Unlimited for hosting the Health Cities Breakfast. For those of you who've been at our breakfast before, you'll notice it's a slightly different format. We've changed the format to accommodate this cool venue. So thank you all for joining us this morning. I'll start off with a land acknowledgement. We acknowledge that we are here on Treaty 6 territory, the traditional gathering place for many First Nations, Métis, and Inuit peoples. We recognize Indigenous communities in our work and emphasize the crucial role Indigenous peoples have always and will continue to play in exploring and leading health innovation. As you know, we're in the midst of Life Sciences Week, so tons of activities going on. Life Sciences Week is sort of the premier, inaugural event here in Alberta. There's a number of events that are going on, including the Buy Alberta Gala tonight and so forth. So please join us for all of those events. And I'd like to recognize that we do have representation from the provincial government here. We have 4 MLAs with us this morning. Thank you all for making it. We have MLA Roswell, MLA Ellingson, MLA Sir, and MLA Lovely. Thank you all for being here. We're going to kick off with some pitches just momentarily, but before we do that, I just wanted to let everybody know that for the folks that are pitching, they are set up around the venue as well. So if you hear something really interesting from one of their pitches and you want to go chat with them, you'll have that opportunity to do so as well. Also want to just give a special thank you to Covenant Health. Jennifer is here on the panel. Thank you very much for being here, Jennifer. But we also have Connie and Tyler. They were integral in helping us set up the content for this panel this morning. So round of applause for Covenant as well, please. Thank you. And so Lisa, should we call up the pitches first? Yeah, okay. Awesome. All right. Well, the first pitch is going to be from Calgary company Kaleidoscope XR, and I'm going to hand it over to David.
Hello. Didn't realize I'd be the first one. Okay. So across the world, there are 50 million people living with dementia. As the global population continues to age, there's going to be a substantial increase in aging-related diseases such as dementia. It is forecasted that the dementia cases will double every 20 years. To put that into context, that's a person getting diagnosed with dementia every 3 seconds. Dementia is a family disease. It affects not only those people diagnosed with it, but it also affects the family. We all know somebody that's been affected by this disease. For myself, it was watching my grandmother deteriorate mentally every day the last year of her life, but it was also watching my father provide care for her in a daily manner, but not be well prepared for the difficult situations that he faced. In response to this, there's going to be a huge demand for well-trained and well-skilled caregivers. This includes formal caregivers such as nurses, nursing assistants, but also includes informal caregivers such as family caregivers like my father was. This is the result of healthcare systems across the world making home care a priority as a result of the growing healthcare cost. So, if you notice though, across, you look online, there aren't a lot of resources out there to teach people the practical soft skills needed to provide care for dementia patients. To address this, Kaleidoscope XR, our company, has developed a solution called Caregiver VR, where we connect educators with trainees through virtual reality. And this platform enables soft skills training by facilitating standardized patient simulations that allow trainees to role play as caregivers and as dementia patients, and dementia patients that are experiencing the symptoms of dementia. Things like going through visual hallucinations where a user one moment is in a clinical care setting, the next moment they're visualizing their home. Or audio hallucinations where they're hearing a baby cry constantly over and over again, while others in the room are not hearing that sound. The reason we do the simulations in this way is because we want trainees to truly empathize and understand what dementia patients go through in order to provide more compassionate care. But we want trainees to also learn how to properly communicate with dementia patients and learn how to show compassion and patience when dealing with difficult patient scenarios, such as when dementia patients are angry, aggressive, violent, depressed, etc. So you may be asking, why virtual reality? The reason why is because according to a study done by PricewaterhouseCoopers on soft skills training through VR, virtual reality learners are 4 times faster to train than classroom learners. They're 4 times more engaged than their e-learning peers. And virtual reality connects educators with trainees in a scalable and hands-on manner that traditional ways of learning just simply do not. So what's our ask as Kaleidoscope XR? 1, if you want to learn more and want to get a demo, please visit us after the panel session in the room over there with the Caregiver VR banner. 2, we're looking for partners to pilot this solution with. And, specifically, we're talking about healthcare providers and nursing schools. The vision of this platform was to have these types of institutions share knowledge and expertise with one another through the platform, but the other vision was to have them share their knowledge and expertise with family caregivers in a more hands-on manner. Thank you for your time.
Thank you very much, David. Exciting times for sure in the life sciences sector. We have another pitch for you from a local company here in Edmonton. Let me introduce to you Arnie from Click and Push. Arnie, come on over.
Well, hello. Good morning. I came by DATS today. Normally, I get picked up at 6, and then I'll be at the UA at around 7:30. So I get a tour of the city. Yeah. But now I came at 6:27. I was the first one to come here. I was the only one in the bus. Anyway, so what if I need to go to my doctor's appointment also in the winter time with snow? The elevator at the Southgate Mall is not working. So those are the things we face every day with mobility impairments. And we know the people responsible for these needed changes. And I see the people here who's going to make that happen. We have people, 4 MLAs and the companies here. So if we can make that. Another thing is, look at outside our building. There is an amount of visibility of just the active construction going on in the city. And as a result, they put access. But unfortunately, the access provided, it's only for someone who can walk, not just for wheelchair users. So that's a sad thing, too. The accessibility and the cost is not a priority in awarding construction projects. In 2019, the Accessible Canada Act became a law, and it builds with the Canadian Human Rights Act. So the act commits to making Alberta or Canada barrier-free in 2040. That's only 17 years from now. And in response to that, Click and Push created the Atlas. So it identifies and classifies barriers, shows how to avoid them, and also include information on how we can remove them. To do that, we did an extensive customer discovery with the stakeholders, the city planners, the cyclists, the large construction company. The work continues, and we identify 5 areas or targets. These are individuals, like most of us, the transit operators, the community and groups and associations, the cities and municipalities, and of course the construction companies. And the Atlas is very ultra portable, so it resides on your mobile device, hands-free, and you just say, "Hey Atlas, can you add a curb cut? Can you add a pothole?" At the exact location where you are. And our team here, Dr. Martin Ferguson Pell, Dr. Nathaniel Maida, our CTO, Martin is our president, Sydney is our CEO, and they're here. Our team is very passionate to improve rehabilitation and people's lives. Thank you.
Thank you very much, Arnie. I think you can learn more about Click and Push right over there. Arnie's going to be over there for the rest of the morning. So before we get started with our panel, as our panelists are all here, I'm going to bring Nicola up just to talk about an interesting technology accelerator program in age tech. Nicola.
Hi, thank you. Hi, everyone. Good morning, and thank you so much to Health Cities for letting me speak a few minutes this morning. My name is Nicola McFarlane. I'm from the Innovation and Business Intelligence team with AHS, for those of you who don't know me. We assist the health system with innovation. I am the lead for a new Envisage beachhead for Alberta. The Envisage program is developed by MedTech and AgeWell. It is supported by the Strategic Innovation Fund. And it is a 5-year program that will assist in connecting partnerships between innovators and receptors. The aim of the program is to get the right technologies, technology-enabled solutions into the hands of older adults, caregivers, and their healthcare providers, to aim to improve the quality of aging for older Albertans. And so this technology accelerator will assist innovators in accelerating their technology through commercialization. And if you have any questions, please let me know. I'm at the booth over there. And as the beachhead, we will assist in the evaluation and methods for adoption. All right. Thank you very much and have a great morning.
Thank you very much, Nicola. All right, let's get started with our panel. This is going to be a fun and interesting conversation. I'm going to pass it over to our moderator, Badea, who also happens to be our board member. Badea, thank you.
Thank you, Reg. Well, good morning, everyone. How's everyone doing? Oh, I know it's a Thursday. Life Sciences Week has been very long. We have one more day and a jam-packed with the BioAlberta dinner and the showcase. Nanostics has an announcement. There's a ton of things happening today. But I am most excited to be here. For those of you who don't know me, I lead our healthcare, life science, tech, and innovation practice across the region at Deloitte. I work a lot within aging, and some of you in the room, and super excited to have our fantastic powerhouse panel. I will not do it justice to introduce all of these phenomenal ladies, so I'm going to pass it off to Jennifer to introduce herself.
Good morning. Thanks so much. So my name is Jennifer Olson, and I am the Senior Director of the Network of Excellence in Seniors Health and Wellness with Covenant. So Covenant Family is actually comprised of Covenant Health, Covenant Care, and Covenant Living. So our portfolio, which is part of the larger innovation portfolio, is responsible for really disrupting the aging space within the three aspects of our family.
Karen.
Good morning. Good morning, everybody. I'm so excited that we sold out today's event. Usually you put the word senior in event and we don't necessarily sell it out, so thanks for being here. I'm wearing a dual hat today. I'm the executive director of the SAGE Seniors Association here in downtown Edmonton. SAGE provides services primarily to low-resourced older adults who experience barriers to service delivery. We provide social services, recreation programming, community development. We do a lot of work in public policy with our colleagues in government and really work to reduce barriers to service delivery. I'm also the provincial director of an initiative called Healthy Aging Alberta. Healthy Aging Alberta works to coordinate community-based senior services across Alberta, working with organizations that are delivering non-medical supports right across the province.
Thank you, Karen. Sarah.
Good morning, everyone. Thanks so much for being here, and thanks to Health Cities for this opportunity. So I'm Sarah Agvami. I'm the director of Best Buy Health. Most of you couldn't connect the dots, but Best Buy does have a health department. Our focus is to simplify technology for different needs. In this venue would be aging in place as much as possible. So I'll be happy to talk to you about that. I won't bore you with the rest of my details, but let's just stick with the focus that I brought in today.
Thank you. So we all know about 40% of our provincial budget goes to healthcare. In 2020, 1 of 10 Albertans were over the age of 65, and it's forecasted that by 2046, that will be 1 in 5 Albertans. I believe 19 to 24% of seniors have felt isolated, and that has incredibly increased given COVID. And so, we'll start with Jennifer because Covenant is doing some phenomenal things as an innovator in this space, and you're doing some amazing initiatives and programs. Can you tell us a little bit about some of the work that you're doing?
Yeah, absolutely. So as mentioned, Covenant really does span the age span from birth to death. And so although I could kind of bore you with all of the innovations that we're doing throughout our organization, obviously we're here for an age tech session, so I will focus on our older adults. So for us, I just kind of wanted to kick off by saying, foundationally, our network is grounded by our Courage Action for Aging project. So in partnership with SE Health, we're really launching this social movement to reimagine aging. So how do we spark innovation? How do we embed technology? How do we really make this a space where older adults want to age and can do so in the place that they choose? With that being said, we also have our Seniors Innovation Platform. So we have this opportunity to bring together people, processes, technology providers into this one space to really, again, make sure that the quality of life of our older adults is met and that we're meeting the needs that they tell us need to be met. So a couple of the initiatives that we're working on now, just to highlight a few, is one of our Covenant Care sites is working through a staff engagement process using a digital AI tool. So each day, their team members are able to check in and let them know how they're feeling, how they're doing, what types of work challenges have come up today. And that really is allowing that real-time feedback for managers to respond to any needs that might be present instead of waiting for that annual or biannual satisfaction survey to come. So they're just kind of in the throes of their launch and they're finding some really great success in terms of making sure that team members really have that, ability to interact with their manager in that anonymous sort of way. We also have our Covenant Care and Covenant Living sites working with various telecom providers to actually test devices for older adults. So often devices are made without the input or co-design of older adults, and we just expect them to know how to use them. And I don't know about how many of you in the room, but I think about the number of times I get called from one of my parents about, I don't know how to use this remote, I've turned off the TV, I can't figure out how to turn it back on. So really what they're doing is they're working to not only design that hardware to make it older adult friendly, but also to really make some of those instructions that go with it to make it user friendly and, helpful for them. And the last thing that I'll highlight is we have a couple of our sites, both in Covenant Health and Covenant Care and Covenant Living, that are really exploring virtual reality for residents. So allowing them to really integrate into those entertainment experiences as well as the immersive experiences to really allow them to visit across the world, to engage in experiences that they might not otherwise be able to. And they're really excited to actually take that to the next level and start to use it for treatment to see whether or not it can be used as an augment to pain management. In terms of the future's bright. We've got lots of projects in the hopper, so a couple to just kind of touch upon. So we are going to be doing a robotic-assisted feeding trial. So sites are super excited about that. So really for our residents that have that upper mobility limitation, having that device that can assist them with feeding so that they do not have to be fed and can interact with others around them. We also are doing a technology integration project. So really, how do you kind of take all of this technology that's out there and bring it into one space so that we can actually do something with all of the wonderful data? And we're also doing a pain assessment pilot where we're using a web-based application to actually use microfacial recognition to assess pain for those that may not be able to self-report pain, such as with those that are cognitively impaired. And last but not least, I want to shout out to our hospitality folks because we're also doing robotic-assisted cleaning. And the residents are actually quite excited about what that might look like at one of their sites as they see their little robots move around cleaning their space. So the future is really bright for Covenant, lots going on. And I know lots of you in the room were in chats about other projects and looking forward to chatting with more of you about potential projects.
Thank you so much, Jennifer. Wow, a lot of things on the go. I know we have some representatives from Covenant, so if you have any more questions, we'll have time after this, as well as Connie and Tyler are somewhere in this room. So Karen, you have worked for several years with aging adults, and you have seen firsthand what it takes to implement, develop a successful program, one of which is a unique service delivery model with SAGE. What type of ingredients, based on your experience, does it take for some of the startups here, and even organizations that want to implement program? What does it take to develop and execute a successful program?
Yeah, I wanted to touch on a few key ingredients, although I'm sure that many of you could share your thoughts on this as well. SAGE annually serves between 6,000 and 7,000 seniors right across the Edmonton region and beyond. One of the approaches that I think is really fundamental to SAGE's success in service delivery is a holistic model of service delivery that really looks at the needs of the whole person and the integration of social care needs with primary care needs, looking at how we integrate. Our mental model of service delivery is really thinking of 3 pillars of service delivery in Alberta. We have our colleagues in the health system, housing, and community-based senior services. And I think that shared mental model in Alberta is really begun to be adopted right across the board, not just within our organization, but within other systems and within government as well. We have 4 pillars in our approach at SAGE that I want to share with you all. Co-creation with seniors, recognizing that our services are centered on the needs of older adults and their voice and perspective, but also that our staff and our volunteers come to the table with their own expertise. Self-determination. When our social workers are working with an older adult to establish their goals, the senior is determining what success looks like for them. It doesn't always necessarily match what we might feel success looks like, but it really is the senior determining what success is for them. It's a relational approach. Community-based senior services is really about establishing, ideally, a long-term relationship with that individual and centering that relationship on that individual long-term. So it is really a relational approach. Asset-based. So Often when we're talking about senior services, we talk about the needs of older adults and we lose track of the strengths and assets of older adults. I've been thinking a lot about how we move through this post-pandemic period, and we all know that our social fabric is a bit frayed at the moment. Our economic situation and the cost of living is putting a lot of tension on our communities and on families. Older adults are the largest percentage of volunteers. They provide the largest percentage of unpaid caregiving. They are the largest percentage of philanthropists in our communities. I think our post-pandemic recovery is going to be driven by older adults. If you think about what happened, for example, in the AIDS epidemic in Africa, it was grandparents that helped move people through that crisis. Seniors are assets in our community, and I think sometimes we take a deficit approach to service delivery for this population to our peril. Seniors, I think, if we think about a community asset-based community development approach to our service delivery, seniors are the greatest assets in our community, and we can lose track of that very quickly, especially in this post-pandemic recovery phase. So I think an asset-based approach to service delivery is critical. Partnerships and collaboration, you all know this because you're here and you took the time at 7 a.m. In the morning to come out and connect with one another. Our services are stronger when we are working in collaboration with one another. SAGE, for a period of time, had a primary care clinic right embedded in a community-based organization serving seniors who otherwise were not able to access the care that they needed in partnership with the Faculty of Nursing at the University of Alberta. That's a great example of an innovative partnership. Healthy Aging Alberta has an unbelievably unique approach to co-creation with the Government of Alberta, with the Division of Seniors and the SCSS Ministry. These types of approaches to partnership are fundamental to unique and creative ways of developing services that are more sustainable, that are able to activate resources and networks that are otherwise not possible. We see the same thing in terms of the development of activation of technology in the space, particularly in community-based organizations who otherwise would not have the resources to do that type of work. When we think about the role of community-based organizations, I think sometimes there's not clarity around that role relative to other systems. Community-based organizations are complementary to those systems. They are agile, they are well connected to community in a way that larger systems often are not able to connect to those communities. They have the ability to activate resources like volunteerism and philanthropy in ways that larger systems often are not able to. And so they're complementary to our other systems. And so we need to activate those resources in unique ways.
Thank you, Karen. It's interesting listening to you because CD Howe Institute this month actually just released a policy report that compared Canada to 11 countries, and we scored 8 out of 11 for senior older adults in terms of lack of equity, access, and affordability. So I think we have quite a ways to go. Which leads me to Sarah, because I didn't know really Best Buy had a Best Buy Health service option or delivery for their business, and you're working on some really interesting projects like the Citizen and Healthy Homes. Can you talk about that?
For sure. Honestly, I didn't know even health makes sense for our brand, to be frank and honest. So 6 years ago, our parents' company in Minneapolis kicked off Best Buy Health. Their vision was about fall detection and all the services that comes after the fact. And then most recently, through acquisition, of course, they just bought companies that was really good at this. And most recently, they purchased a hospital-at-home model right out of Ireland. Apparently, that was an award-winning technology, and they brought it to US. So through all their programs, everything that stuck well for them, it was working really well. Canada was getting excited. It's like, what can we get this in Canada? Luckily, we have friends in healthcare and social services. We're like, does this make sense to you? If you bring it across Canada, they're like, I don't know. We have social services here after a fall. US doesn't. So I'm like, well, I was happy. We were kind of sad we couldn't migrate it. And all the way through hospital at home, which is the most recent model they have. So we're very different cross-border for multiple reasons. One of them has to do with private pay in US is the only way to go. So folks who pay in such programs in US are not going to be the folks paying into that in Canada. So we had to shift and think really quickly on our feet, because it made us, to be honest, it took us 2 years to know what we wanted to be. And it was only through conversations and learning the population of Canada is when we got to a place where we created some services. So we just surpassed 40 million population through immigration. Like, that's how fast it's happening. But the fact is, though, we are having less babies as a population, and then less of them are getting to healthcare in form of education. And as a result, the ratio of caregivers to care recipients are declining pretty fast. So right now we have 7 million seniors and we have 9 million caregivers. That was a much higher number in the past than 9 million. So we get to live longer, which is, again, amazing, but there's no life design past 75. Nobody's designed how are we going to live past that point. I mean, it's great that we're living, but how are we living? So our focus came out from, so we're like, we don't want to play doctors. So we started shifting over what are we good at. So there is health span, which my lovely friends here are working on, and we started looking at lifespan, the quality of life. So by the time you hit it, we have great partners who take care of your health or well-being. We started working on the environment of the being within the household, knowing that a whole bunch of these factors actually have impact on health outcome. And in fact, we did a collaboration with Health Cities. There was, if you might have heard of Health Tech Condo, where a younger, older adult was moved into the space, which was amazing. I think the whole concept was around early adoption. And we started positioning technology as an augmentation for this individual. I wasn't there to serve them anything. They weren't supposed to know anything beyond the basic knowledge. And we programmed the house so this individual can have an easier life. Although she was younger, she had early cognitive health decline, upper body didn't have much strength. So things like robot vacuum, things like leak detectors within the house, things like smart lock, for example. I mean, we see it, it's nice to have, but it actually made a huge difference to her life. So that became a lot of basis of those two services we have developed. One is fresh and free. Hopefully we can pass it on to social communities. It's called Best Buy Digital Citizen, which comes from one of the wonderful ladies on my team that comes from social services, specialized in gerontology. There's a whole bunch of free courses. It's even password free, so nobody has to think about it. And it's tech jargon free, so anybody can come in, just look at the information and get on with their life, which is the whole purpose of closing that digital gap. And then as soon as we did that, and we did a whole bunch of projects across Canada, and I'm so glad to say at this venue, Alberta is the most organized and structured province when it comes to coming up with solutions, whether health or aging in place. Because there's one next to choke as far as regions are concerned, where other provinces have multiple regions, multiple opinions around that. So congratulations on that. But it goes to say that we started bundling solutions for, call it a condo in a box, of what we believe and the occupational therapist on our team believes is going to work for individuals who can stay in place. So we made it simple. We work with our vendors, the Googles, the Apples, and everybody else out there, because we do have that muscle, unlike smaller companies, to curate only what's good. So call it as the sommelier of technology. And we put in one place, individual shows up, the blue shirt, which is our salesperson, turns it through. The most important component is not the tech, because who cares about the hardware? It's the in-home implementation. So our Geek Squad agents, who are within 95% of our Canadians across nation, they have gone through extra training. So in addition to sensitivity, vulnerability, all that jazz, they know how to turn on features within devices. So visual impairment, hearing impairment, or the folks who just don't want to interact with technology, they don't have to make it interactive. They program the house and they leave. To me, that's the golden component. It's not so much of a secret sauce, but that's our only sauce that makes tech stick. And if they leave and they don't have the affordability to get on with our annual membership, there's Digital Citizen. They can pop online, ask any questions they want, and again, get on with their lives. So that's where we are today. I'm sure lots of other things will happen as Canada's going forward, as Alberta is innovating in different spaces. But I feel like we found a good place where we're not being too close to the individual's being per se and health factors.
Well, congratulations, Sarah. Best Buy Health is doing some phenomenal things, and I very much agree with you. I fervently believe that technology is an enabler, and there's a variety of different elements like people, process, change management, workflow that need to be part of that transformation to enable success and to increase access to care. So great work. We're going to do one more series of questions, and then we're going to open it up to everyone in this room to ask a question as well. So Jennifer, obviously Covenant is doing some phenomenal things. You've shared some really incredible initiatives that you're doing. There's now becoming a more focus on aging adults. I think COVID has kind of unleashed, the opportunity and the need. What is your advice for some of the startups, scale-ups, organizations here in the room for them to consider as they're developing solutions to this large challenge?
Yeah, I guess a couple. I think before we kind of get into those, just to kind of highlight what's already been brought forward, which is, we are going to become a super age society in less than 10 years. And frankly, the data shows that people over 50 actually have 50% of the money to spend. So it's a population that not only will need to be addressed, but wants to be addressed and will spend to be addressed. I think the other important thing just to realize is when we say older adults, it depends on what age you think an older adult is. Some think it's 45, others think it's 65, right? But when you think about the definition, the word older adult might span 40 or 50 years. So I mean, clearly what someone who's 45 needs will be far different than what someone who's 85 needs. So I think just keeping in mind that, that age group is wide, it's varied, they have, varied level of accessibility, of functionality, different streams of income, different support systems. So all of that really just needs to kind of be, kept in the back of your mind. Which then, of course, leads me to Karen's point, which is co-design is critical, not just from the testing stage, but also from the idea generation stage, the how you're actually going to build it stage, and then the testing stage. And then, of course, appreciate that technology changes very quickly. So depending on what you're building, how's it going to change both from a software and a hardware perspective? And what does that then mean, again, back in the co-design process for those older adults? I will also say, some tips. So over the last 2 years, we've actually spoken to over 1,000 people who are either older adults or who work with older adults to really ask them, what are the areas that they think technology can benefit them most with? And basically what we were told was safety, medication management, staying socially connected. They want something for fall detection, and then really environmental controls. So to Sarah's point, how can we make sure that where we're living is set up to really assist us and not work against us in terms of trying to successfully age?
Thank you, Jennifer. Karen, I think there's a lot of misconceptions for aging adults. I think people think they can't use a phone. In some cases, they really can't. My grandparents can't, reset the Wi-Fi. What are the largest misconceptions, especially when it comes to technology for aging adults?
Yeah, I think there's a few things I want to unpack there. In Western society, we are all influenced by ageist belief systems, all of us, whether we realize it or not. And what we see in our work at SAGE is that older adults have internalized ageism, all of us have, and so our perception of ourselves influences our ability to age well because those internalized ageist belief systems limit our ability to age well. So we think that we are not capable of doing things because we're older. That will influence how we engage in things like physical activity, where we choose to live, how we participate in social activities, whether or not we're at risk of social isolation. Unfortunately, that is internalized ageism. Ageism influences the way that public policy is developed, the way that our organizations exist, the way that our society functions. So we have to acknowledge it so that we can actively try to counterbalance those things. So I wanted to mention that. I think that the way that we perceive older adults in Alberta, it lags the reality of the diversity of the population. Older adults, just like all age groups, are very diverse in Alberta. There is definitely the affluent pickleball playing suburban senior who's traveling to Florida, who has the resources to do that. But there is also an extremely diverse population here who maybe doesn't have the resources to do that, where English is their third language. They may be living rurally. They may not have children. Our public systems depend on caregivers, and so their experience of those systems may be very different without a caregiver who can help them reset the Wi-Fi. So their experience of technology may be very different without a family member to help them with that technology. So we tend to, with everybody, we tend to default to stereotypes when we're imagining older adults because it's easier. So I just want to say, as Jennifer pointed out, older adults are an extremely diverse population, and so when we're designing products and services for the population, we really need to acknowledge the diversity within that population, which is great from a product development perspective. There's an enormous array of products and services that can be designed for that population, and it's increasing. So that's beneficial. And also to acknowledge that the organizations that are providing services to that population are equally diverse, and that the services that they're providing are complex. They are of extremely high quality. I think, because we internalize those ageist belief systems, sometimes the organizations that are providing services to older adults are by seniors and for seniors. So a lot of those community-based organizations that are run by seniors and for seniors, we don't necessarily value those organizations for the same reasons. And so a lot of those small little nonprofit community-run voluntary organizations, they are doing critically essential work to support the well-being of those older adults, and they reflect the diversity of Albertans right across the board. And so I just wanted to mention they are also maybe more diverse than we expect.
Thank you, Karen. Very well said. Sarah, Best Buy Health is leading Healthy Roads Lead to Home mindset, which is really interesting. Can you share your perspective on the opportunities for integrated care, connected care, and tech enablement?
100%. So the caregivers we're talking about can also be supported through everything I just mentioned earlier. It's not necessarily down to the individual. So both caregivers and care recipients' health kind of end up in one space, which we call home. And a lot of times we spend all of our lives, money, youth, building a house, paying off for a house. But when the time comes where the house needs to take care of you, it's not possible because we didn't plan ahead of time. We didn't do all the right things in time for the house to do a few things for us at the end of the day. And those things do result in some form of shape, whether disease types, whether it is ability levels or missing limbs at times, do impact us down the road, unfortunately. In fact, Government of Canada just published an aging in place checklist most recently, which I think is made up of 8 different components. So although that was our feeling, it was just most recently kind of confirmed that is the case. So prepping our space right now, no matter how old we are today, either we're a caregiver or a care recipient or one of those sandwich generations where you take care of younger and older, God bless you, you need to really prepare about what makes your life easier. And these things are investments, we call them, right? Yes, we buy a lot of things, and of course, most of the manufacturers only designed for folks who got the money, all the big brands you're already aware of. So I don't think they will ever include us, to be frankly, at this point in time. So adaptation of this space, not necessarily always through tech. There was a time in life that, even toilet was considered technology. So it could be low end, it could be mid end, it could be high end, all the way to all the wonderful things AI has to cover. And at some point, I do invite home improvement folks like Home Depot, Rona to be at the table, a lot of times in coordination with rehabilitation experts to design such spaces. When one just having a good old time, hopefully they never, see the change of aching bones or just bodily strength bothering them, and therefore help them age even faster, just not have a good time. So that's our philosophy at the end of the day, but making it accessible, making it affordable, and making it integrated with everything else in the home, which is like a big flaw of the system, because not all operating systems are friends yet, for God's sakes. So if you're iOS customer, Android will never play with you very well until such time Meta comes. We can talk about Meta after the chat if you're interested. But point being is the space we live in for 90% of the time, if not more, is a place we need to really think about seriously in all aspects.
Thank you, Sarah. Okay, rapid fire. This is a call to action, and then we're going to jump to questions from the audience. In order to sustainably make an impact for aging adults to build better lives and to age with integrity, and for us to collaborate, continue to collaborate, Karen, to your point, with public and private sector, what is each of your call to action to everyone in this room, government, everyone outside this room, for Alberta and beyond? 20 seconds. Jennifer.
20 seconds. Okay, I would say it's just really that open communication. If we're going to continue to engage and we're going to continue to move things forward and really look at how we are sustainable from a funding perspective and how we iterate technology, we have to be really clear with each other about what our expectations are, how do we work together, and really how do we then go together to get funding so that we're not competing against one another.
Well said. Karen.
You're all here this morning, so I know you share this commitment and this vision, but I think really working towards improving that push-pull dynamic between community and seniors and their participation of product development and research so that we can move upstream, so that we're engaging community and seniors earlier in the process in the development of the research question and the product development, so that we can really fully engage in that process in a meaningful way.
Love it. Last but not least, Sarah.
For innovators out there, please, please, please know what you're solving for, what pain you're remedying, because where I sit, 8 out of 10 solutions already been done before. So use your smarts in a way that makes sense for our communities. And if you're already at that stage and you got a whole bunch of approvals and feels good, feel free to reach out to me. We can give you a digital shelf space on bestbuy.ca where you can start commercializing your solution. That's our support of the innovative space out there. So that's it for me.
Thank you. All right, we're going to open the floor to any questions from the audience. Awesome. All right. Thank you so much.
Good morning, everybody. I'm Trish Josephs from Ignite Technology. We're a technology integration company based out of Calgary, national company that has now spun out a subsidiary just focused solely on healthcare. For you three, I'd like to actually know how our government has been engaged with each of you in driving this forward. Because from where I sit, I see a lot of good things happening with government. So I'd just like to know how they've engaged and what kind of funding they've brought to the table for you.
Yeah, I would say that our government partners have been very open. So they're always willing to, ideate with us, always willing to, assist where we can match the need to the funding. So I would say, yeah, we've got great relationships with folks like Alberta Innovates, the Can Health Network, a number of our ministers that we meet with on a regular basis. I would say that government is super open to moving this space forward and, basically are willing to take your call at any point. You just actually have to reach out to do it.
Karen, Sarah?
Yeah, I've had a similar experience. We have, through the Healthy Aging Alberta initiative, I mentioned the co-creation approach. It's unique, I would suggest, in government, even beyond Alberta, from what I've read, in terms of a development process between a community-based organization. The United Way of Calgary is acting as a backbone for Healthy Aging Alberta, so they're holding the grant funding, they're employing the staff, but a community leadership council of executive directors and seniors themselves from across Alberta are providing the strategic direction and the governance structure for that initiative. And then the sponsoring ministry would be SCSS with the Seniors Division. They have been unbelievably supportive starting back in 2018 when we did an engagement process to develop, I say, the social license to begin that work through community, through both financial investment but also an enormous amount of staff time through the ministry. And I think there's a real genuine recognition of the value of community through that work, as well as the role of government in terms of the development of public policy. So it's not just about funding, it's about a recognition that community has expertise and knowledge relative to the development of public policy, around non-medical supports as part of the continuing care stream. Sarah's here today. You know, there's really important role for community-based organizations in supporting seniors to stay in their homes for as long as they choose. And if our public policy is to shift away from facility-based care as our primary way of supporting seniors in terms of housing into community-based care, community-based organizations are going to play an essential role in that. So we need a systemic approach to supporting that, and government has really recognized that we need a co-creation approach to delivering on that public policy approach. So it's been very positive in that area.
Sarah, anything you'd like to add?
I mean, if you ask my therapist, he will tell you that government doesn't see for-profit as a place to invest in. In a way, it was understanding in the past, but you know, profit is not what it used to be with the manufacturing changes in China. Having said that, we try to influence the bodies that are funded and hopefully is driving towards the same agenda. And then we try to show our skin in the game in that perspective. I say this, at some point though, that Canada has to overcome this taboo of industry and non-for-profit, because that's where the winning countries are getting at. So Holland, all Scandinavian countries, whoever's doing it right, and UK just starting to do that, is they know that muscle is required in order to expand solutions across Canada, or in our case, we're stuck to the border. I'm sure we can solve for it. But yeah, I hope that day comes.
I think we have time maybe for one more question. Who's the brave soul? Marina.
Hi, everyone. Thank you so much. Such a great panel. I'm super passionate about aging, and I joined the board of Drive Happiness, which is offering transportation, and I know we worked with Sage. Thank you for your support. I'm very curious about, you mentioned collaboration, so I would like to learn more about what kind of partnerships do you have, each organization, and how does that help you to deliver on your mission?
Is that pointed to the entire panel or one person?
The entire panel, if
Okay.
possible.
Who wants
Thank
to
you.
do that?
I would say we're collaborating with everybody, right? So from the first question about collaborating with government, we collaborate with early adopters, and we're still kind of helping think about, what the solution might be based on the pain point that, is being experienced. But then also those that have already, developed technologies and are either looking to try that out in the older adult sector or wanting to iterate based on the needs of that specific population. Right down to those that are actually looking to commercialize their product, as Sarah mentioned. So sometimes there's just that great solution that's already been built, and it's time for us to just, whether it be buy it off the shelf or try it off the shelf and, go from there. So I would say fantastic question, and for Covenant, it's a matter of everyone. We would like to collaborate with them all.
Yeah, similarly, I think our board asked me to itemize the number of partnerships once, and it was over 100. It's a list. But what I would say, there's different types of partnerships. So Sage, for example, we believe we can achieve our mandate by supporting grassroots, loosely organized community groups through an intermediary approach, as the term CRA often uses. Sometimes you hear it called being a fiscal agent on behalf of a small group, like a men's shed, for example, all the way up to the example I used for the primary care clinic where we worked with the Faculty of Nursing. So sometimes it's a legal formal partnership where we're delivering services where there's a contractual agreement and everything in between. I will say, though, there's probably people in this room that I owe an email to about potentially working together. It is unbelievably labor-intensive and time-consuming to work in partnership. It is the right thing to do. We deliver better quality services by working in collaboration, but it is extremely labor-intensive, and to be frank, we've had a net reduction in capacity over the last 3 years, and so our ability to work in that way has been diminished, and so it's a challenge. Our systems are better for it, but we do need to structure funding for service delivery in a way that supports administrative capacity to deliver services in a collaborative way. So things like evaluation and administrative support. My time is often not funded in grants, and yet guess who's showing up to have those meetings, right? So I just want to acknowledge that it is the best way to deliver community-based supports and beyond community supports, but it does require investment. So thanks for the question.
We're running low on time, so 15
Super
seconds,
quick.
Sarah.
For sure. We wouldn't be here if it wasn't for our collaboration. So name it, healthcare research innovators out there, rehab folks, all around. And for the researchers, what we do is we give them access to what we're talking about, just to know if you're on the right track. So I'm super grateful for everyone's generous time across Canada to teach us a few things or two. So everyone.
So with that, we're coming to a close. I did want to thank all of you for coming and having this phenomenal discussion. A big thank you to Health Cities, Reg, Lisa, Kim, Ann, Cassandra, wherever you are, thank you. And to our fantastic powerhouse panel, Jennifer, Karen, and Sarah. They did a phenomenal job. So thank you, and Reg, pass it to you.
Thank you very much. A round of applause for Badea, our moderator. Badea, thank you very much. So just a few thank yous here. First of all, I wanted to thank everyone. Well, first of all, I want to thank Edmonton Unlimited for hosting us in this wonderful venue. It is great. I think it lends itself very, very well to this kind of format. I'd like to thank everybody for coming this morning, especially for those of you who have traveled. I know our public representatives, our MLAs, have all traveled here from somewhere else, so thank you very much for making the time to come out here this morning. Special thank you to our long-term collaborator, Kiwi Productions, Bryce, Pranita, Ryan, thank you very much. If you're looking for any other production work, these guys are really tied into the innovation space, so have a chat with them after the event and encourage you to do so. I also want to thank everybody who helped us set up for this event. The Edmonton Unlimited team, thank you very much for all your help, as well as my team, the Health Cities team. Thanks very much. Next event is Health Innovation Day. So some of you may be aware that Startup Week is coming up on the week of October 10th. And we have our Health Innovation Day right here again. And it's going to be a whole day of events talking about startup community, how we look at different forms of innovation around healthcare and social determinants of health. We're going to be looking at mergers and acquisitions. We're going to be looking at investments for startups. We now know with the companies that we have in Alberta, particularly in the life sciences space, we've moved beyond startup. We're in the scale-up phase. And we're starting to see how these jobs are actually contributing to the bottom line for GDP for Alberta, but it's also contributing to the health and wellness of our population as well. So it's an exciting time. Please join us on October 11th right here for Health Innovation Day. And Sandra, if I could ask you to come on down. Oh, you are here. Excellent, great. So if your folks are able to stay for a little bit, we have Sandra and her team here from the Heart and Stroke Foundation to talk to us about cardiac crash. And there's going to be a demonstration, is that correct? Yeah. Sandra, do you want to give us just a bit of what's going to happen?
Sure. Sounds good. My name is Sandra Staple. I'm with the Heart and Stroke Foundation. We're a national charity focused on heart and brain health through the spectrum of care, from prevention to saving lives to healthy recovery. This morning we have a very special offering focused on saving lives. We train almost 500,000 Canadians each year in CPR. Most of the time we focus our attention on our healthcare providers, but as of last week, we're bringing to market a new offering. It's a gamified, innovative kind of experience for the workplace. It can be done in under an hour. And so we're hoping to spread this to workplaces across Canada. There's also a school version. So this morning at 10 a.m. from 10 to 11, we're going to hear from a local person that actually experienced a cardiac arrest and survived. Then we're going to do the game together, and then we'll finish off with a panel of thought leaders, all local thought leaders in resuscitation science. We actually, whether you know it or not, in Alberta are a hub globally in resuscitation science. We have incredible depth of knowledge and kind of wealth of opportunity here. So if you can, stick around. We'd love to have you. Thank you.
Thank you very much, Sandra. So that brings us to a close, everyone. Thank you again, everyone. Quick reminder, there's a QR code. We'd love to hear your feedback on this event, so you can just click it. I think it's just a couple of minutes, and give us your thoughts and feedback on the event for today. Thank you, everyone. Please stick around. There's still coffee. There's still some food. Lots of networking opportunities. Thank you.